We've all learned CPR, but nursing school might throw in details that are often overlooked. Let's go through them. For both adults and peds, we're going to do these steps in this order. We assess for safety in the environment and check for a response by the patient. Big key, infants, we flick the bottom of the foot to elicit a response. We then call for help, delegate someone to call 911, or initiate rapid response. Then the nitty-gritty, we take 10 seconds only to assess breathing and pulse. Remember that we check for pulse in adults and children at the carotid site and infants at the brachial site. Then chest compressions. Big key, the depth of compression should be at least 2 inches or 5 centimeters for adults. I remember this by thinking 2 hands or 5 fingers are used for compressions. For peds, we use 1 to 2 hands depending on the size of the child, and 2 fingers for infants. Hands or fingers go in the lower half of the sternum, initiate 30 to 2 compressions to rescue breaths, and pinch the nose for that rescue breathing. But for infants, we tilt the head into the sniffing position and place our mouth over both the infant's mouth and nose for rescue breaths. For AED tips, remember that the adult pads may be used on a child older than 8. If the child's younger than 8 and there's only adult pads available, place an adult pad on the front and back of the chest. And remember to never leave the patient alone.